Brandi Glanville's ordeal with facial disfigurement and new treatment. Brandi Glanville, the outspoken reality television personality best known for her appearances on The Real Housewives of Beverly Hills and later Real Housewives Ultimate Girls Trip, has been facing one of the most frightening and public health battles of her life. What started as a sudden and mysterious facial swelling quickly evolved into a prolonged medical crisis that has left her appearance altered, her career in jeopardy, her finances drained, and her emotional health deeply shaken. For someone who has long lived in the public eye, the sudden disfigurement of her face has been both a personal trauma and a very public ordeal, forcing her to share her journey with fans while enduring relentless scrutiny. Her medical crisis began in the summer of 2023, only a few months after filming a season of Ultimate Girls Trip in Morocco. At first, Brandi experienced what doctors believed to be stress-induced angioedema, a condition that causes sudden swelling beneath the skin. The swelling became so severe that she was hospitalized, when her face ballooned dramatically, making it difficult for her to breathe, taste food, or even speak properly. Although she was treated and stabilized at the time, what followed was far worse. Her symptoms did not resolve, but instead morphed into something far more mysterious. Over the next several months, her facial structure began to change. Areas of her face seemed to sink in. Her skin developed painful lumps and sores, and she reported disturbing sensations under the skin, almost as though something were moving or bubbling inside. At times, she described feeling as if something was having babies in her face, a horrifying and surreal symptom that deepened her fears. Some days her face would swell dramatically. Other days it would drain and hollow, leaving her unrecognizable even to herself. Brandi began a medical odyssey, visiting countless specialist immunologists, rheumatologists, infectious disease doctors, dermatologists, and surgeons in search of answers. She underwent rounds of lab testing, scans, and imaging, with bills piling up into the tens of thousands of dollars. She has said that her medical expenses have surpassed 6 figures, an unbearable burden that forced her to admit she can no longer keep paying for treatments on her own. Despite the staggering cost, clarity has been elusive. Many of her doctors initially could not agree on a diagnosis, and for a long time she was left in limbo, unsure whether she was fighting an autoimmune condition, a bacterial infection, or even something parasitic.